Well, hello and welcome to another episode of Enrichment on the Go. I am excited to have two of my special guests back with me, Dr. Sharla Walker and Miss Keyanna Williams. She is, what grade do you teach?
First grade.
First grade, yes. Dr. Sharla, can you tell us what you do?
Yes, I am. My name is Dr. Sharla Walker. I'm a pediatric nurse practitioner. And so I work with kids, babies, like newborns, all the way up to age 21. So I work general practice pediatrics.
Awesome. Thank you for that information. So today we're going to be talking about how to best support children with special needs. And I feel like this is pretty close to my heart because, there's no child that is unable to learn. I really want to say it that way where a parent can hear it, because oftentimes when we hear special needs, we think, what is wrong with my child? My child is, it used to be retarded, right? Or my child is stupid. Mm-hmm. And that is farthest from the truth. Okay. So what we want to do, parents, is change our language and change our perspective. And let's start saying, my child is unique. Okay. So your child is unique. And when we all take an introspective look at ourselves, we're all unique. No one is different. No one is the same. We're all individuals. So let's think about this. I really want you to think, what are the individual needs for my child? Okay. So I wanted to start out that way so that I can change your perspective and so that it can help you take down the guards. Because oftentimes, when you see a delay or see where your child isn't speaking like another child, or my child isn't walking yet, or my child, they don't make eye contact, right? Or something of that nature. It makes you look at your child. And for some people, it honestly can make them look at their child as though to be ashamed, or, like my child's ugly, or, just certain things come to mind. I really want to help you as a parent to not look at your child that way. And it's not that you mean to, right? But let's think about that. We all can form different biases. And so what I want you to do is get out of yourself in regards to that part and look at the uniqueness of your child. Okay. So we're going to discuss today some special needs and what that looks like within the classroom and how we all work together. If you all have been listening to any of the podcasts that we've done, my biggest thing is working as a unit, right? So working with the parent, working with the teacher, working with the provider, working with your pediatrician, because we work as a unit for what? You all know, they've been following for a while now, for the development of the whole child, because our goal is to meet the demands of the child and their development for every stage. Okay. So let's discuss some best practices, I guess, for special needs, or just your take on special needs as a teacher.
I think your introduction was well said. I think that especially having the approach of special education as a unique field, like it's very unique. And also just the saying, like, comparison kills. So just looking at your child as a unique individual and not, comparing your child to, their cousin or their brother or sister. I think that's a really important mindset to kind of if you do have that comparison mindset, to just change it, because that affects how you do approach your child with special needs. So I just wanted to say that. But going into just the collaboration of it all, I think it's so important to just when you are working together with the teacher, with the parent or guardian, with the special educator, and sometimes with the pediatrician, it really makes such a difference. I feel like, one, for the parent, well, for everyone involved, but also for the child, for the whole child, because all of this, the environment has a huge influence on their needs and their development. And sometimes I feel like parents want that extra, support because it's tough.
Mm-hmm.
So just knowing that, the doctor supports me, just knowing that the teacher supports me, all of that really helps put the parent or the guardian's mind at ease.
And I like what you said, because, and I as you were talking, it made me think, because oftentimes parents, you think that, let me say this, you want our support, but we want your support. And sometimes it's not looked at, because you look at us as the educators. Oh, that's what we do. You should be doing that. But in actuality, if we're working as a unit, we can't do it without you.
Yeah, everyone has a part to play.
Right. Mm-hmm. Everybody has a part to play. So, Dr. Sharla, can you just give, we're going to dive in, but I want your take on what we just talked about.
Absolutely. And I will agree with Keyanna that your introduction was one that was really, really needed, right? So a lot of times parents do find themselves, well, my other daughter did or didn't do this, the cousin does or doesn't do that. And, even too, respecting the fact that, if a parent has a child that may be diagnosed with a special need, that there's a level of grief, right? They had an idea when they found out they were pregnant. So even, when I worked in the NICU, same thing. Nobody ever thinks that this could happen, but then, dealing with that appropriately and then making sure that we, like you said, address the individual needs of that child, because all of us are unique, right? Me, I have a younger sister who is on the autism spectrum. So to me, I've grown up in that environment and having to learn that, what that looks like as a sibling. And now as a provider, I'm able to better relate to my parents when they talk about the challenges, they're up all night, and all of those kind of different things, and us having to make adjustments. So I think, we want to value the child still has value. I love that you said that every child can learn. They told us that my sister would never be able to, to speak and, all of these things. And at the time, she's 20 years old now. At the time, though, we didn't have a lot of the tools that we have now, ABA therapy and all of that. So even watching the resources become more abundant, it has really helped. And my sister works a full-time job. She graduated high school. And so, I would just want to encourage parents, as I do when I'm in the office. We say what we say based off the knowledge that we have, but I highly encourage, do everything, do the appointments, do the PT, talk to the teachers, talk to your early childhood development specialist, because every child can learn, right? So even when it's hard, just continue to encourage yourself and enjoy your child, right? My sister, she is hilarious and adds a lot of good flavor to, she shakes it up a bit. The things that she says, she's hysterical. So I really agree with everything that you ladies said. And, it's okay as a parent to have that moment of like, wow, I wasn't expecting this, right? But then, very quickly understanding that you're not alone, that there's a multidisciplinary team that's ready to help you. We have the tools, and, it's a journey. It's not something that's going to happen overnight, but you have the help along the way.
And and another thing, what I want to dispel, right, is that special needs only means, let's say, autism. Mm-hmm. You could have a child who's talented and gifted.
Yes.
That is a special need. Why? Yes. Because they are for instance, I know one of my oldest, right? And they said he was acting out in the classroom.
Yep.
So I asked in kindergarten. So I asked specific questions. I said, okay, well, do one, I feel like our school system needs to change altogether. You know how I'm a total advocate, because young children are not going to sit for a long duration of time.
Mm-hmm.
And so parents, what I want you to look at and think about, even as we're talking, is the setting of the classroom. Okay. So putting your child in a smaller classroom setting, which would be considered special needs, may be the best thing for that child. So a child with ADHD, right?
Yep.
In a classroom of 25 children, it's not happening. In a classroom of 7 to 10 children, even maybe 15, depending on the age, it's a much more calmer environment.
Mm-hmm.
It's not as much activity, because children, even infants, can become over engaged.
Mm-hmm.
They can become over immersed in an environment. And so what we want you to understand is, and so if your child wears glasses, that's a special need.
Yep.
If your child, I'm trying to think of some other things, but
Even asthmatic kids,
asthmatic,
right? We have
there's
special paperwork that I have to fill out to make sure that they have the tools that they need. And honestly, that's something, as my sister has gotten older, she knows that she has, she's autism, on the autism spectrum. And so even with that, I always explain it to the children, hey, all this is that we're going to give you, everybody deserves the tools that they need to succeed. You need different tools. And my job is to make sure that you have access to them. That way they don't feel weird, outcast, or anything else, right? And so if you have a child who's asthmatic, they have special needs. A child who has type 1 diabetes or any kind of chronic health illness, they have special needs. They have to go to the nurse. And so we want to make sure that we are integrating as much normalcy as possible for all of these children. You're right. It's not just autism, and it's not always just mental health needs. If you have a child with a chronic illness, they, some kids just want to go to lunch. No, not my type 1 diabetics. They have to go to the nurse and get finger pokes. And so even that can wear on them emotionally and impact the way that they interact at school.
And one thing that we've always done, even in the center, because we've had children, we've had a diabetic, we've had an asthmatic child, if a child has a speech impediment or their speech is not the same as others, right? Inclusion. This is what I want to talk about. Mm-hmm. Inclusion means that, and that's why education has evolved tremendously. So I'm not knocking that, because there used to be a time, decades ago, where they would put these kids away like something was wrong with them, right? Yes. But no, that's not the case anymore, right? Inclusion allows for diversity within the classroom. See, diversity goes beyond just your ethnicity.
Yep.
Diversity is talking about everything that's unique about a person, right?
Characteristics.
Yeah, say it again.
I said many characteristics.
Exactly. So one thing that we do in the center, or have done, is, okay, yes, because the diabetic had a pack on. Mm-hmm. He had a pack, and it was actually the tubing went into his bottom. And so he had a pack, so we would have to look and poke his finger, and we had to do special training. And the children saw us doing it. They weren't interactive with it, but they saw it. Yes. And so it's just, we have to help him do something different, right? And we never made the child feel out of place.
Yep.
I think it's very important that whatever setting your child is in, never allow the teachers or the students.
Yes.
This is very important. Or the other students to make your child feel less than. Mm-hmm. And I've seen this, and because children develop biases as early as 3 and 4. Mm-hmm. So I want to let you all know that. Okay, so we all develop our biases, so we have to work through those for the betterment of each other, because none of us are the same. Okay, so let's talk about discussing confidentiality, because that's very important, especially within the classroom for teachers. There shouldn't be this mocking, if there's allergies or something of that nature, all of that information needs to be, let me talk from the center aspect. It needs to be posted, but it needs to be covered, because by law, we are not supposed to, let all of that information be known.
Mhm.
All right. It shouldn't be seen by, if you have a parent walking through your program and, you have, that's for the staff. It's confidential. All right. So, but if they're going on a field trip or something, yes, someone needs to know what's going on.
Mhm.
But it should never be to where it's discussing, make sure your staff is careful, even with, if it's not to meet the need of the child, parents make sure, if it's not for that, to edify, to assist with the child, that it's not for bashing or, to almost make a mockery of, right?
Yeah.
So let's talk about IEPs. You know about IEPs?
Yeah.
Let's talk about it.
I did actually want to touch on the confidentiality, and it's sometimes, well, in most cases, it's also to protect that child from when other people do create these biases in their head about that child. And also that's on an adult level, but in the classroom, it's where it's bullying. And you were talking how, young kids can develop bias. I mean, they see race and all of those things at such a young age. And, we have bullying as young as pre-K, so
I've seen it. Yes.
Yeah. So it's just like things that we just have in place for the safety of our child, for the safety of the student, and just also so they have the opportunity to realize that. And that's kind of why I love people's first language, because it separates the child from the special need or from the disability, because it acknowledges that, yes, you do have these special needs, but you're also a person. So it's like, stops, like, it's kind of just saying, like, I have a child with autism, and not just saying, she's autistic. No, she's more than autistic. She's a person.
Yes.
So that's kind of an approach that I have when I also am teaching my students too. Because sometimes, like, kids come to school with language, and I'm like, wait, okay, I'm glad you know that, but let's, tweak it a little bit.
Yeah.
So that's just something also to just teach the child, like, you are more than, a disability. You are more than, this label that they put on, and that helps with their mental health. Like, that's when they feel loved and nurtured and all of that other stuff. And that also means that you see them beyond, the label that has been placed on them. So I also just wanted to say that. And just dealing with IEPs, I know my I wouldn't say pet peeve, but I guess the thing that, like, I want to advocate the most is for parents to ask more questions. Like, I have been in meetings, IEP meetings, and the parent is silent. And I know that they're silent because they have no idea what we're talking about. They have no idea what's going on. And it's like, they want to ask questions, or they think, we are the experts. We got it all figured out. And, they trust us. And I do appreciate that trust. But, if you don't know something, ask.
It's a great. That's what we want you to know, parents. And I always tell my parents, you are your child's first advocate, right? So when they come into the teacher's meeting, or they have the information from the pediatrician, our job is to work with you, but also to let you know, okay, we have the education, but your child as well. So let's work together. Let's put all of that information together, and let's make it happen for your child. Right? That's why the developmental screenings are important. Even with this piece, they're even more important. Yes. And I express this more and more, but early intervention is key. When I'm doing interviews with parents, or even when I'm discussing everything, I let them know that early intervention is key. And I say that, and we do developmental screenings because I want them to, and they're involved in the developmental screening and the parent teacher conferences, even within the early childhood, or some people call it just daycare, child care facility, because
Enrichment centers.
Yes, yes, we have to catch, listen, proactive as opposed to reactive. Proactive parents as opposed to reactive. I want to say it one more time. Proactive as opposed to reactive. Hey, my child is not. So let's just say, hey, Miss Tanya, I just feel like they're not talking that much. Or, even if you are with, because we all have our biases, we got to deal with them, right? So, I don't want to say Becky. That's hilarious. Sarah. Let's get another name. Sharla was 2. And at 2, Sharla was talking, she was full sentences. But Jaden, my son, I noticed he's not talking at 2. Right? Well, we all know that, this is statistics, and we have to look at statistics, because what we want to know is that it just because there are statistics doesn't mean that your child's not learning. We know that little boys and little girls don't always learn at the same rate. That doesn't mean that it's always the little girl that learns at the rate a little faster than the boy. So I want to be very clear. All right. So because it just depends on the developmental needs of each and every child. I am giving you all a scenario. Okay. There's a big difference. All right. So, but you say, okay, so, or, well, my next son, the next child is a boy. And I notice he's talking faster than this, the middle child. That's a boy. Okay. So you're noticing things, which is not bad, parents, because now that means you're paying attention to development and you recognize some things, but you still have to ask the questions.
Yes.
If you don't ask the questions and you just always make assumptions or never say anything, then we as the provider, the teacher, the caregiver, because when they come into you all, you draw blood, right? You take weight. But it may be something developmentally going on that if the parent doesn't speak up, you don't know about.
We have, most appointments are 20 minutes-ish, right? And so I love what you were talking about with all of us being on the same team, because everybody's an expert, right? You're an expert in your field. Keyanna, you're an expert in your field. I'm an expert in my field, and parents are experts in their children. You live with them, right? So what I see in 20 minutes is different than what you experience at home. And so similar to what Keyanna said, my biggest thing with parents is when you come in to do those forms, especially in the pediatrician's office, we know they're long, but really pay attention and really answer the questions, as thoroughly as possible, because they matter. And so I know, for the most part, sometimes parents are like, girl, this thing is 8 pages long, this ages and stages questionnaire. But when I explain, we're really, really wanting to make sure that we check, at 9 months, 18 months, we're following up to ensure that your baby's hitting milestones, right? And so it's really important that you're asking the questions, that the information that you have, you're giving it to us as thoroughly as possible, so we can make sure that we're putting the pieces together, because early intervention is key. Most states have, I know here in Florida where I am, when I have a parent who, let's say it's not quite that they're showing a severe delay, but even if the parent has a concern, we have a program called Early Steps, and Early Steps will send the early intervention specialist to your house for free up until the child is 3 years old. But if you're concerned at 4 months, 6 months, 9 months, and you don't tell us anything, and then, they come in for their 24-month visit, now we only have a year left of this free service where they come to you, right? So even if parents, don't worry about insurance and time off, a lot of times we have tools that you may not know about where we can assist you to make sure that we are giving that child the tools that they need. There's a lot of consideration that goes into it, whether or not they were born prematurely. So there's a lot of things when we discuss development that we look at from a pediatric side. For children who are born early or that are NICU babies, they get until they're age 2 to correct, right? So if your baby's born a month early, when they come in at their 2-month-old, they really are developmentally acting like a 1-month-old. I'm not concerned, but we want to watch closely because we're expecting that baby to catch up by the time they're 24 months. And so it's really important, even having that discussion, if you are concerned, we can either reassure you and we can come up with a plan that works best for you and everybody's on board and you're not just sitting, not feeling well about taking your child home.
And I like what you said. And then, yes, there are specialists that can come in. Now, talking about that, because I have an early childhood center facility, we work with specialists. Now, I know my facility does. Any high quality childcare center is going to work with specialists, right? So we've had specialists to come in and work with the child on their development. They ask us questions. How does your program run? What's going on? And then we work with them and we've had them come in and you remember, and I monitor the specialist because if they aren't, I monitor the specialists. I'm going to leave it at that, but you want to make sure that they are really getting to know the child and making sure that they are meeting the child's need. I have spoken with parents, but we have to, as the facility, we sign off on the form when they come in. We schedule the time. They'll ask us. So we work with them. So because, it's fine for them. They're going to come to your home too. I need to say that. They're going to come in and do a home visit, but they're also they will work with the facility because they know parents are working, right? Yeah. So they want to see the child in the most natural environments. That's why they come to the home. And that's why they come to the facilities. Yeah. So they get to see the child and how they're engaging across all platforms. That's why even the specialists know how important it is to work as we're all working together as a unit. So we may, the specialists may come in, I've said to the specialists, my observation, well, they came in this morning and they were very cranky. It was a 3-day weekend. They're a little tired. So I don't know how the session is going to go. But that's a great observation for that day.
Yep.
And we have to, because again, we're working with the child. So what we want to make sure you all understand, the IEP is the individualized education plan.
Yep.
Individualized education plan. So that is meeting the demands or the needs of your child. I sat in on IEP meetings. I've had parents who, ask me, hey, can you come into this IEP meeting? What do you think? Ultimately it's up to the parent. I will give my input, if you ask me, and especially right now, parents, with everything that's going on.
Yes.
I want to say that again with COVID, it's very important that because you need help. Now your children are home with you more. They're starting to try to integrate back into school, but we don't know what's going to happen. Right. And so with it being so volatile right now, we need to work together even more, right? Because we can help you. That specialist, the pediatrician can give you ideas. The specialist can give you ideas. The teacher can give you ideas. Because what we don't want is the delay to be where your child becomes even more delayed.
Yes.
Yep. Right. So you are going to have to do your job as a parent, even when they are in school. I have to say this because I've seen this in my facility, right? Where the parent, they want the child to get all the homework done while they're in the child care facility. Well, that's not you. That's taking you out of your role as a parent because you still have to make sure that you know what's going on. And please, please, please show up to parent-teacher conferences. If you can't make it, have that conversation and say, hey, I can't make it, but can we have a conversation? Can we set up a separate time? If you miss it, we all miss dates, okay? Who hasn't? Okay, but reach back out to the teacher. What you never want a teacher to think is that you don't care. Because when you don't show up, and if there are things that the teachers are sending home, or they're contacting you, or your pediatrician is calling, there's an alarm that goes off to say, no one's caring for this child. There's something going on. And we see it anyway in the classroom. But we want
Same for our appointments too.
Say it again.
Same for our appointments too. If you're missing appointments, at some point we are very concerned. And whenever we do see the kiddo, if stuff is going on, and a lot of times because they feel like well, they're not sick, so why would I bring them in? It's those developmental screenings. All of it really does work together. Those specialists, those early intervention specialists, I sign off on the care plan. So after they come into your facility and do all of the screening and all of that, they write up, oftentimes they're like 8-10 pages. And I go through and I read the care plan and I update their chart. So then when you come in, I can say, hey, I saw on our care plan that, we were doing occupational therapy, and the goal was in the next 3 months for us to be doing, for us to be able to tie our shoe. How are we doing? And if mom said, hey, we're struggling in this area, whatever the case may be, I'm able to also we're all kind of keeping tabs to make sure that we don't lose track of things. So I know a lot of times, parents may feel overwhelmed, especially with a new diagnosis, but you have to lean in on the team while also playing your part. If you bring them to the appointment and something's going on, I may be able to say, hey, maybe there's something else that we need to assess. Maybe we need to get case management involved so they can help you with organizing appointments and getting things set up. So there's tools that we have as well. But we are very concerned, especially with COVID, the American Academy of Pediatrics and all of us just as a team, with children not coming in for their well visits because parents are fearful of coming into the office. We are preparing for delay, to see children that may have severe delays because we haven't even seen them as medical providers to assist and intervene on our end. So, it's really, really critical that you're touching base with people in the team, because we don't want to get in and not provide that child with the tools and the time necessary to get them on a level playing field that's best for them.
And before we wrap up, I want to say one more thing, parents, because if your child already, it has a special need, whether it's a language delay, hearing impaired, maybe it is their sight, maybe they're on the autism spectrum. Whatever tools and resources you were using when this first started, you need to keep going with those. You can't lag. And I want to express that because what happens is it's almost like a muscle, right? If I never squeeze my fingers together, my fine motor skills at some point are going to go limp. Even though I have the muscle memory to remember, but I never use the skill, okay, or the muscle. Now I'm losing the skill. So I want you to understand that your child is going to lose the skills that they've already gained if you're not being consistent, okay? So we've been talking about best practices for children in other episodes, and how to positively discipline and all of those things. This goes with that because the routine has to stay as normal, or because COVID shook us all up. We have to be realistic with that.
Yes.
But we have to maintain a level of routine so that we all don't, have mental
Even during the summer. Mm-hmm.
So what you need to do is even talk to your child about what's going on, or ask them, how do you feel? All of this is going to go, and I mean, it's really going to be something. I've been saying this for quite some time. If your child is not in an early childhood education program, you know, or and I understand, I'm not, but if you can, you know, and they're making safe, you know, having safety, or at least meeting with their teacher. And I would admonish you, even listen, when they're in class, sit in, listen in, be earshot of when your child is, you may have your earbud in. Come on, parents, we are so savvy, right? We know how to make things happen, right, Mom? You know how to make it happen. That's what we do. We are multitaskers by nature. We're multitaskers. Right? So the teacher could be writing out a lesson plan and hear a child and know exactly which child it is. Right? So Mom, the same thing. You can be listening. Listen for what the teacher's saying. If there's a lot going on, and you know, they're trying to gain control over a virtual space, which is for young children a lot. Okay? And it's almost not even possible. So it's very important. Or hey, if that teenager can come over, or if that, and we're going to talk about that in other episodes, but if that sibling is older and they don't start school till later, work as a unit even in your home, right? Work as a unit in your home. So hey, you don't start school till 9, or you have a half-day schedule. So I need you to sit with your sister just to be in earshot, to hear what's going on. It helps to keep everybody engaged and involved. So we want to give you, as I always say, tools, tips, resources to assist you. But please know that the teacher, the facility, and your pediatrician and those education specialists, we are here for you.
Yep.
Absolutely.
We are here for you. And my last question, not to us, but to you as a parent, is when you're looking at your child, or you're doing anything with your child, interacting with your child, what do you see? What do you see? Because delays can come in. They don't have to come in early. Sometimes they can come in later.
Yep.
So my question to you is, parents, what do you see? All right. So thank you for tuning in, and we'll see you next time.